Okay, I'll do a quick introduction about the purpose of this session. We're inviting the assured suppliers who are meeting all of the criteria on the assured supplier list to actually do a presentation on their systems and hopefully dive in a bit deeper in terms of added functionality, features that current users might not be actually using. The purpose is to try to ensure that people use these systems to the fullest extent possible, and also to provide you with an overview of what the system developers are actually designing, what's coming down the pipeline, what the future will look like. Today we're hosting PCS, Person-Centered Software. Quite a few locations within the Dorset ICS are actually using this system, so we think it'll be beneficial to dive in a bit deeper. And this webinar is being recorded. It will be uploaded, and the intent is to create a library of digital resources so that people can revisit those at any point in time, try to understand a bit more about the system that they're using, or if they're still exploring the option of going digital, trying to get a better idea of what's out there in the market and what might cover their needs. And on this note, I will pass on to Rachel Walters, who is from PCS, and she has joined us together with Nikki Barbridge today. And Rachel will start the presentation. There'll be a Q&A session at the end, and we'll take it from there. Thank you very much. Rachel, to you.
Rachel, you'll have to unmute and put your camera back on. It's knocked you off when the recording started.
See, didn't that go beautifully? Apologies, everyone. Let me start that again, if I may. Okay, let's go from the top. Thank you, Alex, for that introduction. As you say, today's all about really doing a real deep dive into MCare. Many of you are using the system already, but it's just to give you a real overview of some advanced features and functionality in the system. Nikki's going to be doing a deep dive into that sort of live demo for you. So, you know, today's going to be a really interactive session. So if you've got any questions, then please feel free to jump in at any point. We do have a Q&A session at the end, but once we're in the middle of that demo, you know, we've only got a small group today. Nikki, that's okay with you, isn't it? You know, if you're thinking about when Nikki's running through the demonstration, if there's anything that really comes up, please just jump in and ask away if you would. So yeah, just to give you a brief introduction, I'm Rachel Walters. I'm the Business Development Manager in the Southwest. So I'm here to help and assist in any way I can. We're joined today by Nikki Burbidge, who has huge amounts of extensive knowledge and knows this world inside and out. She's a total hero. She's our digital transformation consultant. Again, lives in the Southwest as well, so we're really lucky to have her in our region too. Both of us are here to help and assist in any way we can. So today's agenda really is to do that deep dive into our Care Up. We'll give a brief overview there, then into the main dashboard and show you some of those advanced pieces of functionality and systems that you as care home owners, managers will be able to hopefully put those systems in place. Many of these pieces of functionality you may already be using, but many of them hopefully will be able to give you a bit of an oversight today and bring some value to your organisation. So just a quick overview of person-centered software. I'm sure you probably all know as well, we've been around since 2013, but really the advancements that we've made in the last few years are actually quite outstanding. We now have over 6,500 care homes using our connected care platform, and we've brought in lots of advanced sort of features and functionality on top of just MCare with sort of email solutions, well-being platforms, family engagement, compliance training and staff dependency. But today is all about MCare, and just to give you a little synopsis, you can see the numbers there. They kind of speak for themselves, but from PCS, our digital care system is a market-leading solution that you're using. But really at the heart of all that we do is about championing that sort of digital transformation in the world of care. We celebrated only a couple of months ago over 10 million quality care notes being evidenced every day. So exciting times. But if we may, I'm going to hand over to Nikki just to run through MCare and show you some of that functionality that we're talking about. Thanks so much, Nikki.
Thank you. Hi, everybody. It's lovely for you to join us today. I'm just going to work my way through the agenda, so it's not a full demonstration of everything, but it's some pinpointed areas we thought it's worth going through. Apologies if you're using the system to its full potential and you know all of this already. I'm always happy to have one-to-one sessions if people need a little bit more support or you want us to pop out and visit you on site. That's absolutely fine. I'll just try and share, but you might need to unshare, Rachel. I'll just have a look. There we go. Can everybody see the Care app?
Yeah.
Okay.
Yeah.
Perfect. So I'm going to start with the Care app first. I'm not going to go through it all, but I just wanted to show you one new update on the Pain app before we move on to the main MCare monitor system. Is everybody really comfortable with how I'm going to have a little bit of engagement back here, so you will need to unmute to speak to me. Are the people that have joined that are using the system, are you confident and happy with the Care app and how the staff are using it, and you understand that each care note does multiple updates, so we're adding fluids, updates, fluid chart, hospital passports, etc. Are we all happy with the Care app and its use within our environments? I can't see anyone, so I'm assuming.
Nikki, no one unmuted themselves, but I'm guessing
That's an okay.
people should be familiar with these aspects of the system.
Perfect. So the first thing I'm going to do is just use a demo resident here. Okay, so I'm going to go into ELF. So this is a new feature you may want to take a look at if you haven't read any updates or you've not already utilised it. So it's about the pain recording, and you would go into ad hoc care and you would go to medical. So there's a slight change. If you go in, you've now got the options of how you want to record that care. Okay, so if you're integrated with Pain Check, you'd have the Pain Check option. You've got the Wong Baker, which is basically suggesting what type of pain they're in, a very simple process. Some people choose to use that. And when we save, it will set the pain level automatically, which is moderate pain. And then we would indicate where the pain is. Okay, so let's say potentially we've got moderate pain in the shoulder. We confirm the selection. As your staff would be, personalise that care note, add a little bit more information, and then you would complete. Okay, now I'm just going to go back and unselect those to show you the other options. You've then got the numbered scoring scale, which we can select between 0 to 10, which I think quite a lot of homes use. So again, you would select what the pain level is, save that information. Again, it's dictated that that comes under severe pain. And again, you would then save the recording. Okay, so it's up to you what method you wish to use within the home. We've then got the Abbey pain score, which is great because we currently didn't have that assessment in here before. So again, we would go through and complete the Abbey pain score assessment. Okay, does this all make sense? If anyone would like to answer, would it be good? So we can go through, I'm just going to go moderate with all of those, okay, and then we save, and that will record the Abbey pain score. And again, which area of the body that is in. If we go back, the last one is describing the pain, okay, so here we can say that the resident has suggested that it's a mild pain and that it's in the shoulder. Again, we would confirm selection, he's okay, and complete that care note. So hopefully that's a little bit of a new insight for you. You might have already noticed that it's there and implemented that already, but I just thought it was worth mentioning because I think pain's a really important aspect that we need to be keeping on top of. So I'm going to move over to MCare now. Now, the first thing I'm going to go through is just a brief overview of the dashboard. You may or may not already know these things, but it's worth going back over it anyway. Hopefully you've got your homes set up exactly as you want them to be set up. You can have communities set up, so you've got multiple homes. You should be able to view all of your homes if they're the same organisation and registered with the CQC in the same way, or you can have communities. So I'm just basically looking at one home here, but I could be looking at just what the ground floor, the first floor, zone 1, 2, 3. So just make sure that the system is set up and reflecting how you want that to look in your practice. So you'll be able to select from the drop down, first floor, second floor, or you can have just residents. So if you haven't got that set up already, guys, then please do reach out and we can help get that done for you. So on the dashboard, we can access shift handover, which I'm sure you will utilise. We can plan activities and we can look at overdue actions. More importantly, we can see exactly what's going on the floor, okay? So from the devices and what care has not been delivered. So within care, and I'm sure you know this already, there is something called planned care. Planned care is about being able to prompt certain aspects of care to be done throughout the day. But more importantly, the must-do planned care is for clinical interventions, things that are important where we want to make sure we don't have gaps in our care notes, gaps in our charts, and we want our data to be consistent and accurate and at point of delivery. If we've got must-do planned care that is overdue, the same will apply on the care app. There will be a representation of a red flag. Okay, so red flag is that care action is overdue from the parameters of which you've set. An orange flag, or a yellow flag, should we say, is that it's due now, and a white flag would be that that care is coming up very soon. So that just means from a senior, a manager, and operations, whatever level, we can see exactly what's going on the floor with respect to planned care. We've also got the DNA CPR status and risks to be aware of, and the white is risks to be aware of with no DNA CPR status. The red pencils are care plan reviews overdue, and again, if you hover over, it does give you an indication to what things are, okay? So the little white taxis, respite care. And again, we've got the emotional status coming through to the system that only stays on the screen for 20 to 30 minutes, but we know that Al's had a care intervention and a care note recorded within the last 20 minutes at least. Then we move on, we've got the palliative care and life butterflies following the gold standard framework, and also your PPE barrier nursing for anyone that may have an infection. I'm assuming you're all okay so far. I hope I'm not going too fast for you. I tend to be Nikki at 100 miles an hour, so I'll try and slow it down. The tabs on the side here, when you're using the system, you should see changing based on what you need to be alerted to, okay? So we've got planned actions refused. So it's important as providers that we know this, because this is, if it's planned must-do care and it's reportable, then it's going to be an important aspect of their care, an important prompt clinical intervention, offering fluids when somebody's on a fluid chart, so on and so forth. So we've got 3 residents that the staff have recorded they have actually refused that aspect of care in the last 24 hours. Must-do actions missed. We've got an awful care home here at PCS because we do lots of demos and lots of meetings and we don't review much, but we've also got missed actions. So this means the staff haven't recorded against the planned care that has been put in place, and it's flagging up to let the managers or whoever's overseeing know. If we go into incidents, we've got 18 incidents where the incident reports need to be completed. Once completed, they don't just disappear. It will then flag up for the incident reports to be signed off by a manager. So these are all things most homes would be doing on paper, but because the system has mapped against the regulating body standards and best practice, it's prompting us to do these things. So we definitely want to check the incident reports being recorded accurately with the correct terminology. The correct areas within the accident and incident form have been completed satisfactorily. The right boxes have been ticked in order for us to have that visual data and analysis off the back end that we will look at a little bit later on. Same with accidents and incidents. Now, with the blue representation, we've got things flagging up. So we've got 3 people at risk of must that don't have a must tool in place, for instance. We've got people that we suggest should be on fluid watch because we're not recording any hydration for them. We've got people that are on fluid watch that have had less than a litre's worth of fluid in the last 24 hours. So all really important information just there right in front of us when we log in, and we can see a good oversight of what's going on in the home. And I do talk to homes that are on paper, and they will open and honestly say to get a snapshot of exactly what's going on in the home at the moment on paper, it'll take you a couple of hours to go through all the documentation to know exactly where we stand at this moment in time. So it's really useful to start using the data to see exactly what's going on and to spot check and to be able to see what the staff have and haven't done and what's happening with people in the home. So I'm now going to move on. I'm not sure if anybody can unmute. Have any of you had GP Connect? You might not have been implemented very long and not done it yet. But have any of you implemented and switched on GP Connect so you can access your NHS records through the National Record Locator?
people are being very shy today.
They're being
but,
very shy.
I'll,
Okay.
I'll jump in. It's a very useful feature. We did run a webinar on it, but it'll be very beneficial if you can sort of do a deep
I'll
dive
show it.
on GP Connect. Yes, particularly for those who watch the recording at a later stage.
Okay, perfect.
Thank you, Nikki.
So GP Connect, and I'm assuming that people that are using our system that are on this call received funding, so your DSPT standards met. If you are DSPT standards met, there's a little process you can go through, and as Alex rightly said, the health engagement team did a webinar, so that gives you some indication to how to set that up. But it's very simple. You just reach out to us. We'll take you through the process and we'll get you switched on, okay? So it's a real game changer for pre-admission if somebody's coming from somewhere with little information. Maybe they don't have family that have got all of the information. They don't have the capacity to explain their medical kind of history to you, okay? So have a little look at our NHS lady. Yours will probably have a lot more information because this is just a fake site. So we'll just let that information load. So once switched on, this is pulled by NHS number, so make sure your NHS numbers are correct when you enter your residents into the system, very much like the hospital passport needs that as well. Okay, so as you will see, we'll have the basic information of the resident, the NHS number, and then it will pull through a summary. You'll have emergency codes, your last 3 encounters, any active problems and issues. Again, ours is demo data, so there's not a huge amount here to show, but once you get it switched on, you'll see how much information is going to be pulled through. This is included in your subscription, so there's absolutely no reason if you haven't got it already why you shouldn't have it switched on. It will certainly benefit yourselves and improve the outcomes of your patients and your residents. Your acute medication, allergies and adverse reactions, your medications, current repeat medication, discontinued medications, immunisations. So a good amount of information that is there and available to you, and it makes perfect sense to have that kind of connected world and that connected platform so that you can access all of that information. Hopefully that was helpful. If you already know about it, you've already got switched on, I do apologise.
Nikki, may I jump in with a question, please?
Yeah, of course.
Is there a way currently, once you access the information on GP Connect, right? Because a lot of that data in there will at some stage be transferred onto care plans.
Yeah.
Is there a way to do this automatically, or is it something that's being looked at, developed in the pipeline?
No, it won't feed automatically through because it's historical and current. It may do in the future, Alex. Wouldn't that be wonderful? Like the London Care Record and I think the Cornwall Care Record's being worked on as well. Most people would do their assessments using some form of that information. The assessments will actually then push it automatically through the system to link to the care plans. I think most people producing, or I personally writing a care plan, would probably want to input the information to the assessments myself. Just, you know, it is NHS records at the end of the day, but you just want to make sure that it is current as well. But it's more about us having the knowledge and the access to that information that sometimes we wouldn't necessarily know, and things could be missed, and we might find out about them a year later when they've been living in the service for a long time, but it hasn't come up in conversation. Nobody's given you the access. The GP's not necessarily ran through, you know, the whole holistic profile of that person. So really useful information.
Okay. Thank you, Nikki.
That's okay, pleasure. I'm going to go through some of the features across the top now, okay, guys? And I'm sure you've probably found some already, but I'm just going to go through just to give you examples. So within reports itself, spot checks. So seniors often like to do spot checks and see what's going on in people's care. It may be I've been on leave for a few weeks and I'm a key worker and I want to access a particular resident and look at what's been going on over the last few weeks. Lots and lots of different reasons why we might want to spot check the care notes, okay? And there's also very good reason why when we record care on the app, it's broken down into areas of daily living so we can report, track and spot check within those areas, okay? So I'm going to go back a couple of weeks worth of data here. In this case, I'm going to look at just one service user. But if I was doing a safeguarding investigation, I might want to go back 6 months to a week's period for one individual and look at all the care notes and then start to find them down to find the information that I need for my inquiry, okay? So lots of different reasons. Let's look at everybody. And I'm literally just going to pick on personal care in this instance. So I'm going to pull up all the personal care notes for this time range for all my service users and all of my staff. Okay, so you'll see there's lots of different hygiene entries here. Yours will be even more because we're just working off of a demo site, but I'm going to specifically spot check my oral hygiene. So in this case, I can see each resident, how many entries per day we're having, and I would want to be seeing at least 2 entries per day on each resident in my service. Okay, so that's just an easy example. You can break that down. You could do that for medical and just one particular area. You could do nutrition and eating and just lunch times. So you could just spin data around and look in and see exactly what's going on, see if there's any trends and triggers, and it will just help you. And again, on paper, it would just take so long to get everybody's oral hygiene chart out or everybody's personal care chart out or read through all the care notes. Okay, so really useful way of finding data. Next on, I'd probably recommend nutrition should be used in the kitchen. So if the kitchens have got access to a tablet or to a laptop or whatever they use for their ordering and everything else, there's no reason why they shouldn't regularly be checking on the information. Yours will have a lot more information. This one report is generated and pulled from all of the data from every individual's nutritional assessment that you would have completed previously. And of course, that means that the information is consistent, up to date, and correct. Okay, so it's really important that I think people that are dealing with food, preparation of food, serving food have access to this so we can see what special equipment they need, allergies, even live must scores, and obviously things like your diabetes and your diagnoses as well. So really useful. If they don't have access to a laptop and they don't have a tablet, okay, we want to get away from paper, but you could potentially print it off and put a fresh copy in the kitchen every morning or once a week, whatever works for you. But if you've got access to a tablet or they use something for their stock ordering, that's absolutely fine. They can probably access it here as long as they've got an internet connection. So next on, I am going to look at QR codes. So for those of you that have utilised these already, well done. The QR codes, they literally generate like this. Okay, you can refresh them at any point. So if you're anything like me when I was running homes, I don't kind of trust anything 100%. So I would definitely refresh the codes regularly to make sure people aren't trying to cheat the system. You can print the QR codes out, and for people where they just need a check-in night, you know, open the door, yes, they're okay. The QR code could go just inside the door. It's entirely up to you what your best practice is in your home. For me, anyone with breathing difficulties, risk of seizures, I would definitely have that barcode right next to their headboard. Okay, so you can utilise those, print them out. I'd probably laminate them so they last and don't look all raggy. But those can be placed in the rooms, and you can go in and they need to take the device to the QR code, scan the device, that'll take them automatically to Alf Jones night check, and then I can complete the note. Okay, and then there's reports and things that you can generate to check that those QR codes are being used. If you don't like that idea, but you like the idea of something actually being scanned within the room, we also provide NFC tags that are just stickers. They don't have anything written on them. There's no copyable trace of any kind of code. That they will be programmed to the person and the element of care. So high dependency nursing, a lot of my homes will have Beryl Jones fluid intake, and she's got that on a fluid trolley in her room. Beryl Jones, I don't know, I've used the same name there, hopefully. An NFC tag that is programmed to the hoist. Okay, so it can literally, you scan and it takes you straight to that person and to the note, and it actually gives you harder evidence that they are in the area and with the person because it's on their equipment in their room. So lots of things. Reach out one-to-one if you want any more information on that or any of the aspects we're talking about today. But absolutely 100%, I love all these processes, and the future of digital technology is just outstanding. I was actually at a Doncaster DSCR event on Tuesday, not Doncaster, that's absolute rubbish, sorry, Brighton. And it was very much about the future AI and how things are going to move on. So once digital care is kind of embedded, how many other amazing products there are, like Pain Check, that obviously if we improve pain management, that moves on to, you know, improving people's sleep, hydration, nutrition, reduced fall. It's just huge now. So keep an open mind. Digital care does take quite a while to set up. There's no easy way to do it. You've got to transfer the information over. Some of you might be in that painful stage right now. You will see the light when you come out the other side. There's also, once you're a year in, it's like, oh my God, I wish I'd done this, a year ago. So hopefully most of you are coming out the other side now and you're in the enjoyable bit where data becomes powerful and you can access all these amazing things and put things in place. So
Nikki,
next,
may I jump in while you're on the QR codes, right? And you're talking about data. So if I understood correctly, you can issue NFC tags, which will be placed out, either on equipment or as you enter the room.
Yeah,
The
you get
staff
like
members...
a roll with stickers on and you can program them, but you need an Android device to program. Don't ask me how you program them. I've never
Don't worry,
actually done it.
I'm not going to get too technical because I don't know that bit either. But if somebody really wants to dive in deep, they'll be in
We
contact
can
with you and they'll
help
do it.
them.
But my question is, once you program the NFC tag and people access the tag and therefore the care plan, should the manager need to run an audit trail? Will they be able to distinguish if the care plan was accessed via the NFC tag or
Yes, they will. Yeah,
Yep.
There is an audit trail and they will have hard evidence. And it's great if you've got safeguarding investigations or anything where you need more evidence. And even the QR codes will evidence that, they've scanned the QR code. The only, I would say probably, I would like to think at least 85% of our customers utilize this feature. And if they don't, they probably are using NFC tags. But as long as you refresh them, I can just refresh them now, pull up a new set of QR codes, go around and replace them in the rooms. Okay, so you don't want to be doing that all the time, but you could do it at least once a month as a kind of safety protocol yourself, if you like.
Okay.
So there's lots of different ways.
Thank you.
Perfect. No worries at all. Next on our list is hospital pack. So not the actual hospital pack itself, although I can show that at the end if anybody wants me to. This is just purely looking, are my hospital packs up to date? Are they ready to submit to the NHS? So here we've got an advanced care plan missing. Again, we can go down and we can see a few things to get up to date here, okay? So just nice, simple visuals where we can just see where we are and just check the status of things on a regular basis, as we would have done with paper, but a damn sight easier because we're pressing a button and all that information is there in front of us straight away. If anyone's explored the charts, you can check charts in one place. So this is about when we want to holistically look at a resident. We're obviously going to go onto the resident's dashboard, and that's going to give us all the information for the actual resident. In terms of, I want to check everybody's News 2 scores in the home, okay, all the district nurses in, or we've got an external professional, I can very simply bring up the News 2 observation charts for each of my residents. So I can look at them all in one place and check that everybody's safe and where we actually stand today and what things I need to be aware of, okay? So a lot of nursing homes will do that check a couple of times at least per shift. But it just makes it nice and easy, not going in and out of each individual file to find that information. Of course, you can do that to dig deeper when you need to. And that's the same with fluids. So particularly hot day, again, you've got everything on there, bed rails, everything else. But this is just looking at fluids. We can look at the average intake, so what's been offered and what's actually been consumed for all residents, or we can just define that to people that are just on fluid watch, okay? So there's a lot of, I've read quite a few really useful kind of projects actually where care homes have started monitoring everybody's fluid, and I think we get scared doing that because we worry if we put someone on a fluid chart and we get a gap in the chart or we're not recording it, then we're going to get in trouble. But actually, when everybody's fluid is analysed, and I'm not suggesting you should do this, but it's just interesting research, that a whole home went on to what's like a fluid watch, but we're pushing fluids for all residents. And actually, over time, when they were monitoring everybody's fluids, like the rate of falls decreased, sleep patterns improved. So there was really positive outcomes. But there's lots of reasons why we don't do things in care. And it's normally because it results in a chart and then a chart having a gap in it. Whether if you put someone on a nutritional chart, we do it when there's a clinical need, if you put someone on a fluid chart. But you've got the ability to work how you want to work as best practice in your environment. And all these charts and things are great to be able to access and check whenever you need to. So I'm going to move on to the process section now, okay? So process, there's a few here that you might like to see. Firstly, the one that I love, only because years ago we just had spreadsheets everywhere, and by the time you'd updated a spreadsheet, it was all out of date. Okay, so just to explain, this is almost like auditing where we are with review dates for assessments and care plans. Okay, so these are all the assessments that I've got in place in this particular home. My home's bad because they're red. What we'd expect to see is a green dot, one to say the assessment's in place, and two to say that it's in date, okay, and it's up to standard. So we look at the care plan one, which will make much more sense. I would expect to see green dots, and I'd expect most residents to have a communication care plan, for instance, okay, probably all residents to have finance, so on and so forth. So you know what you would expect in your home with what care plans you would have in place, and you've probably got a standardised procedure that certain care plans have to be put in place for everybody. That's absolutely fine, whatever you want to do, but you want to be seeing green dots. And if you actually hover over, it will actually tell you the next review date, and in the case of it being late, it will tell you when the review date was. Okay, so really useful kind of quick checks and audits, and it's so easy and quick to do. You'll just find that you do those checks and spot checks a lot more often because it's so easy to find the information. It's not a big job at the end of the month where you've got to sit down and go through every single person's file. It's all easy to find there. You'll have other things. I won't go into too much detail on here, but things like care note corrections. So if you had a safeguard and you wanted to see what care notes have been corrected and who they've been corrected by. The standard daily care notes, you've got 31 days to correct, and it has to be someone with the access rights to be able to correct that. Not just anybody can go on and void it, but of course it's still in an audit trail, so we can still see when the change was made and who it was made by. Analysis is probably my favourite area in the entire system. I'm going to go through group reported in just a moment and show you another area where you can connect to that. But first of all, if you're not already looking at these, this is great just to see how are the staff getting on, how much care are we recording, what type of areas of care and areas of daily living are we recording under. So my average care notes per day, I can see that we've got the staff recording activities, communication, continence, medical, so on and so forth. Okay, no emotional support, can't plan that. We don't know when we're going to need to provide emotional support, but we're likely to be providing emotional support on a daily basis. So I can have a quick chat with staff and just say, you know, make sure you use these icons too. What you're recording is amazing. This information is seen by families. This information is seen by our regulating bodies and authorities. It's really good to display a full picture of what's going on in somebody's lives. We've also got average care notes per day. So as Rachel said on the first slide, I can remember only a couple of years ago celebrating, I think it was 4 million care notes a day. And here we are suddenly over 10 million care notes a day. And I swear people don't believe us when we say that. But it's live stats, so it is factually correct, and it's quite enlightening. We don't have access to your data, but we can pull stats from what care notes have been recorded. So again, this is in your environment, how many care notes per day, etc. Now, your results of planned actions is your must-do planned care and what was done what was done on time, what was done but noted slightly later, what was done late, and what wasn't needed at all. So this can just give you a gauge as to, okay, it's great, we're with our planned care, we're recording on time, we're not doing anything late, or actually we planning too much planned care, or maybe not enough. Now, talking about planned care, because I get very excited about all these things, and I've got a delivery people outside, they're not for me, so I hope they don't make a noise. Talking about planned care isn't about institutionalising. Use planned care to kind of prompt staff to record things that you know the strengths and weaknesses in your team, how they record things. So planned care can be good to prompt staff to work in a slightly different way, okay, and to be able to kind of re-educate really how and what we want them to record. The must-do planned care is your really important care. So for me, I would have clinical interventions, News 2 observations, repositioning, offering fluids, all of the important stuff where we don't want gaps in our charts and we want our information to be consistent and we want really, really positive outcomes. For me, that's must-do planned care because we're going to know when it's not happened. So hopefully that's really helpful. Like I said before, if there's anyone wants some one-to-one time with me, We can schedule it in for the future and have a Teams call, or like I said, Rachel can come out and visit you, I can come out and visit you. We can go through things in a little bit more detail. Now, I'm sure you've probably all looked at the analysis, accidents and incident matrices, but again, they're really useful to know they're there if you haven't. Okay, I'm hoping that you all have, because they're absolutely amazing. I'm gonna have to go back and get a little bit more data. So again, these reports are really good as long as the information in your incident and accident reports through the process are accurate and precise and completed correctly. The system has so much intuition, as you know. You add a care note for a fluid, it updates the fluid chart, you know, the analysis, the reporting, the hospital passport, everywhere else. It's the same with the reports. It's pulling from the incident report and then giving you really useful information. So let's just pull some data up, bear with me. Okay, so this example here is I'm looking at my service users. So I've got the service users across the bottom of the screen, and I'm looking by month at when accidents and incidents happen. Okay, let's give you a little bit of information, you know, not that exciting. I can change that around. So if you imagine each of these aspects change the reports, each of the analysed by will change the report. Okay, so there's lots and lots of different reports in this feature. I'm going to do resulting in, because I want my resulting in to be across the bottom, and I'm going to do it by my service user. Now, what this will do, so this is going to help with your KPIs in your month end. I've not got a huge amount of data to show, but what we will see is hospital admissions, overnight hospital stays, staff resuming at work, next to kin involved. Sorry, I've talked so much this week. Next to kin involved, regulation issue is going to be a CQC notifications, rider, and so on. Okay, so really, really useful reporting and information. And again, we've got the colour set to the person in this case. Okay, but we could change that and say, well, actually, let's look at the confirmed impact. Not sure what the data will look like on that, but let's have a little look. So here we've then got, right, okay, so none of those have been entered. Do you see what I mean? So what we should be seeing there is minor, major, so on and so forth. Okay, so your data will be great. Have a play with it, get used to looking at it. You can download, you can print off, you can email to anybody if you need to, and get your head around it for when you get inspected, because it's really great if you know the system really well. When you sit down with your inspector, they probably know it's all there, but they'll probably be really pleased to see that you know how to find all that information as well. Obviously, being in 6,500 care homes, a lot of professionals will know our system. And we do support some of the NHS teams that go out and visit the homes. And we support some of the ICSs, you know, that if they're doing sort of special support with any of the homes, we'll help them to use the system so they can pass that knowledge on as well. So we try and give as much kind of professional support and advice as we can. Back to analysis. So we'll have a little look at the falls matrix. So with the falls matrix, again, it's very like the accident and incidents, but I'm specifically looking at falls in this area here. Okay, so I've got a date range. You'll probably be doing your monthly falls audits, but you might want to check it more often, or you might want to go back to a period of time. You might want to look at the whole year and see how those trends have changed. So first of all, I've got by the hour here, so we can see we've got dominance at 11 o'clock in the morning. Okay, and if I hover over, I can see the people that have actually had falls at that time of day. Now, that will be for whatever reason. On a paper-based home, they're probably all sat down and it's coffee time and writing their notes out in stages throughout the day. Use that as an example anyway. And we may want to look at what location of the home these falls are happening in. So we've got a real dominance in the bedroom. So people being left in their room unchecked too long, we're not using sensor mats where potentially we should be. There's something not right here. Okay, so the real dominance is in the bedroom. Now I might want to say, okay, let's have a look at this by service user, and let's have a look at it by location. Now in this instance here, we've got some people that are always falling in the bedroom, the yellow ones. Okay, if I hover over it, will tell me. And Colin's also had a fall in the garden. But poor old Alf has fallen, well, not entered. We'll assume that should have been entered. But he's fallen in the lounge and he's fallen in the bedroom. He's fallen all over the place. Okay, so it gives you an indication of what's going on. Is there an environmental reason why somebody's falling? Or is it that they're very unstable, their health is deteriorating, and they're actually falling everywhere in the home? Okay, so it just gives you a good insight. You guys know all this a lot better than me, I'm sure, but just finding that data and moving it around just becomes really helpful for you.
Nikki, may I jump in with a question?
Of course.
It's fantastic to see that level of analysis, right? But if somebody was to keep track of their faults and plan actions based on these insights, can they record the planned actions on the PCS system, or do they need like a...
Good question. We could probably do a different session on it another time. You can, some of you might already have it. So during the funding period, some people might have had it included in their packages or paid extra for it, but there is a whole module which is action plans, and you can set up an action plan off the back of anything. And actually, there's an automatic link on the incident report for the action plan. So if it was somebody's fallen and there's a rip in the carpet, your action plan would be obviously to urgently get that rip in the carpet fixed. It could be that we feel it's a staffing scenario and that we need to retrain staff in certain areas of manual handling, or I don't know, whatever we might need to do. So you can certainly set up action plans, set review dates, close those action plans down and monitor it all on charts and things as well. Good question, Alex. Thank you.
I try.
I like being tested.
Well, I'm trying to sort of explore it from the viewpoint of somebody who is either watching this or will watch the recording later on, and they may be thinking, great, I can see what happens, but then I need to take actions after this. Do I need to document those actions on pen and paper, or does the system allow me to create everything automatically?
Yeah, absolutely. And you want to do as much digital as you possibly can, really. We are really proud of our developers. There's lots of systems out there, as you know. Those that are assured, you obviously know about because of the funding. Different systems have been built in different ways. Some systems have been built by a care home group owner who wanted to build their own system, potentially, and then they put it to market after that. Some have been built by healthcare professionals and developers. We're really proud. So we've got a lot of developers, but also all of our developers map everything, okay? And when you're having an inspection, again, most inspectors have probably noticed there, but feel free to show them. So there's a link. If you go to links at the top here and you go down, yours won't look exactly like mine, but you will have a use in MCM features to evidence compliance, okay? You guys all on the call should all be CQC, I'm assuming, unless you're somewhere else in the country or you're moving away. And we are Chloe's, okay? Now, this will break down the Chloe's. So we know we've got the new single assessment framework, but the outcomes are still on reflection to the Chloe's. Now, what we can do here is we can go into, say, effective, and we can look at E2, and we can find out more. And we can say E2.1 is, do people have their assessment needs, preferences and choices met by staff with the right qualifications, skills, knowledge and experience? And then we can evidence the parts of the system, okay, that are utilised in order for you to achieve those outcomes, and what other areas you will then improve your outcomes on, okay? So this is, for me, reassuring that it's not just 5 care home managers saying this is the best way a system should work. Of course, there's customer feedback, but the processes and the assessments and the best practice throughout the system is all mapped, okay? So for me, it's really useful to know this is here. You guys find it on your systems. It's really useful for you to show inspectors if they don't know the system. And it's also really reassuring for you if you're having some issues in some areas, go on, have a look, see what you're not utilising, and allow it to support you. Where are we now? My little list is growing shorter and shorter. Okay, so I'm going to touch on group reporting. Now, you may or may not have group reporting. But I've not been in a home that I've not been able to access it yet, so I'm assuming that you all have it. Now, group reporting is basically, if you imagine when we've got paper systems, we have to audit our systems, okay? You also need to audit a digital care system, of course you do. Now, what this is doing is this is basically auditing the system for you and highlighting to you where there are requirements. Now, if we are keeping an eye on our dashboard and we're doing care plans when they're showing us overview and we're keeping things up to date, that kind of takes care of all of this. But this is our dig deep for operations managers. Groups would use this. No matter how big or small your organisation, it doesn't matter. We all care the same and we all want to know what's going on. So the first aspect here, sorry, Alex, I'm going to have to move you again. There's never a good place on the screen. Okay, so this area here, okay, is safe use of NCM. So I've got my must-do lists, I've got my incidents without a completed form. Let's blow one of these up. So I can bring that into then a date range. I can look at this weekly or monthly. I can change the time span, and then I can go in and actually break that down even more and say, okay, the week commencing the 1st of the 11th, which residents does this affect? And then I can go into their files and dig even deeper, okay? So it's a really useful audit tool. Have a play with it. You'll soon get used to it. You've also got compliance, so falls assessments, your stage 3 pressure sores, etc. Lots of different things like photographs not being updated, all that kind of thing. You've also got business performance, okay? So this will give you a good gauge to that, and your safeguarding. So have a look on your system, see if it's on. Reach out to me and Rachel if it's not on. We'll probably find a way to get it put on for you. Okay, so hopefully that's helpful. One last thing I wanted to mention, hopefully you've all found it, but the majority of screens that you work on, I'm just going to go back to my community, you'll have the question mark wherever you are, okay? The majority of screens that you're looking at, if you press the help button, the majority of screens will bring up a training document just for the screen you're looking at, which is much better than having to go for a big, thick manual, okay? So as we go down through, that will give us a breakdown of how we use that screen, how does that work, what does it mean? And in addition to that, if you want to, and I think all homes should appoint champions, and I think it's no different than all your other training. You're going to retrain your staff on medication every year. You're going to retrain your staff on manual handling. This is capturing an evidence in everything, this system. This is the management of your home. So make sure you keep staff up to date. E-learning's great. Rachel can talk to that about if you reach out to her. So we have got an e-learning module now. It's £15 plus VAT per month, unlimited seats. So all of your staff can do all the modules on it. Absolutely amazing. And you've also got videos and manuals here as well. Okay, so getting started PDFs that you can download, send them to your staff, email them to the staff, print a couple out, pop them in the staff room, okay? So if there's any identified needs or there's weaknesses or things you want to go through, things like the Restore 2 process is really good to watch just to see how that works with your soft signs, SBARD, News 2, etc. All really, really useful information. Breaking down care plan, updates, and you've also got webinars, okay? So these are really useful, so you can just put the video on. If you're having staff meetings, choose one each meeting to play. Get the staff to do a little bit of training and, in the break or whatever you normally do for that. So lots and lots of information. That's all built within the system. Okay. I am going to now be quiet and open up for questions. Becca, Manager Bex.
Well, Nikki, thank you very much. I mean, I had used the system in the past, but a lot of the stuff in there, I didn't know it was there, so to speak. So maybe it's stuff you developed over the years, but it's good to sort of have it presented in this format.
There's a fine line to just show a bit. I want to show you enough so it's beneficial to people that don't know it's there, but I also don't want to overwhelm people that have only just got started. So, hi Bex, what was that? Where? Oh, it's gone already. Hang on.
Oh, there was a message on the chat. I'll read it out. So Bex is asking where she'll be able to find a copy of the video after the session. It will be saved by Laura, and then it will be uploaded on the Partners in Care website, their digital forum pages. We will also send out an email with the link, not just to those who attended the call, but everyone in the marketplace, basically. So keep an eye on your inbox. The link will follow, and you'll be able to view it there. And I'm sure that the link of this recording and the other sessions we run will also go out on the newsletter that Partners in Care produce regularly. So keep an eye out in your inbox.
Rachel's just got a couple more slides just so we can put something up on the screen, which you'll then have on your recording, but you can also take the information down, which is if you just want to directly reach out to us, okay? So if you feel there's something you want to talk to us one-to-one. So I'll hand over to you, Rachel. Thank you for your time, everybody. I hope it was useful.
Thank you very much.
Thank you.
Nikki.
That was absolutely amazing, as usual. So just wanted to show just a little bit of additional support. Nikki obviously showed you through MCare where you can reach out and see some of those webinars that have happened, or the videos that you can access. But we do actually have regular training webinars every month. So Alex, if it's okay, I'll forward you over a link to that you can actually share with the group at the same time as the email that you send out to everyone. But it also has a link on here to our help desk. There's a chat icon, I'm sure you're all aware, in the MCare app, but also there's the telephone number if you want to speak to a human, or email our support team anytime, day or night. We've already run through that Q&A session. Thank you, Nikki. And really just to leave you with my contact details. Always here to help. If you ever need any assistance from Nikki or myself, then please just give us a call. We're happy to help and assist at any time. Thanks so much.
Hang on, there's a question I think just popped up. Sorry, Becca. We've been trying to plan a blood pressure check daily at different times, but each time we put on in, it removes the previous. Is it possible to do this? Thank you for the info, very helpful. Oh, bless you, Becca. Becca, that is, can you unmute, or you've not got the ability to do that? Hello.
Hiya.
Hi. When you set it up, have you kind of done it so you're doing it, have you planned it daily at the same time daily?
No, we were trying to do it so that there was different times, so that obviously it wasn't always on the same shift with the same nurse or what have you.
Okay, fine. And when you add the blood pressure in, say now, what is it removing?
It would remove the one for another time on another day, as it were.
Will it readjust it for 24 hours? So it like readjust the time from like now, 12 o'clock, and then it will readjust it to 12 o'clock tomorrow when you might have had it in at 10. Is that what you mean?
Yeah, I think we tried to set it up so that there would be one in the morning, one in the afternoon, one in the evening, and one at night, at obviously different times throughout that period.
And as soon as same people, or for different? Oh, I know what you're meaning.
It was for the same resident.
Multiples in the same day.
Yeah.
It's just because it's on the same. You've got it set up as like every so many hours, right? Okay, so that's kind of how you set a fluid up. And that what's happening there is I'm offering the fluid, but I'm doing it now, so it's readjusting to 2 hours time. I'm off tomorrow. Rachel, can you write a note down? I want to speak to support. What I would suggest, that there will be a way to do it, and the way I would do it is you'd do the reoccurring, but do them as different reoccurring entries. Do you know what I mean by that? So if you think Outlook, I'm going to reoccur a meeting to be 9 o'clock every Wednesday. I'm then going to set up another meeting for 1 o'clock and reoccur at every. Do you know what I mean?
Separate.
It's a bit of a pickle, but it's how the system is working. So what we want to do is we want you to force the system to do what you need it to do. So leave that with us, Rachel. If you let me think, I'll think of the best person to come back to you on that, Becca. And I don't know if we got your details.
I'm not sure.
Laura should have Becca's details because she registered, hence she received.
Yeah, if you can pick those over, then we can just look at you on the database, put some notes on, and come back to you with that. Was there anything else, Becca, you wanted to ask?
No, that was it. It was just that.
Did you find it helpful?
Make life slightly easier for Becca. Rachel, if you can type in your email in the chat box, then Becca has access to your email straight away, and she can email you directly after this call.
Yeah, we'll get that sorted for you, Becca. Not a problem at all. Did you find it useful today, though? Was it helpful?
Yes, I mean, a lot of the stuff, we're pretty up with a lot of the stuff on the system, but there were a few things that were good to know.
Yeah, I mean, did I sign you up originally, or what home are you at?
Ferndown Nursing Home.
Oh, I did. Yeah, you're one of mine. Yeah. I do kind of cover all of that, but do you know, I think people look at demonstrations, and when you're looking for a product, you'll look at lots of demonstrations over a couple of weeks, and it kind of gets muddled what system does what. And also it's scientifically proven, we did some training, that you could spend an hour or 2 hours demonstrating to somebody, but our brain capacity will only remember 20% of it. So, you're making that decision, aren't you, based on your demonstration in your chats with me or whatever, but then you spend a lot of time just doing the same thing, entering the residents, getting the care plans in. When you come to start to use it, a lot of that's gone. So you kind of do need that additional support. But yeah, if you want us to come in and go for anything else with you, then just reach out and we will be there with biscuits and chocolates normally.
Yeah, of course. Thank you.
Take care. Give my love to everybody.
Very friendly bunch.
Oh.
If only you could send out biscuits and chocolates in a virtual meeting. I would definitely appreciate that.
Well, we'll see what we can do, Alex, but I'm not sure I've got your address.
I have plenty stored around my waist, so don't worry. It's not as if I need them desperately.
Oh, bless you. Well, thank you for your time, everybody.
Thank you all very much.
Thank
you. It's been a pleasure. Laura, you can stop recording now. We'll edit the last bit out, basically. So we'll just keep the presentation bit in. And we'll inform